Hello and welcome to a podcast on Do Not Attempt Cardiopulmonary Resuscitation, CPR, and ReSPECT. I'm Ben Fox. I'm a consultant anaesthetist and lead for the deteriorating patient at the Queen Elizabeth Hospital, King's Lynn Hospital in the UK. And I'm joined by actually my sister, Amber Fox. Amber, do you want to say hello and give a little brief introduction?
Sure, yes. As Ben said, I'm Amber Fox, and I used to work as a critical care nurse in London, but more recently I've started a vegan ice cream business with my husband, and so that is what we do now.
Brilliant, excellent. Today we're going to give an example, and this is a fictional example of something called a ReSPECT conversation. This is something that's quite new in the NHS. And ReSPECT stands for Recommended Summary Plan for Emergency Care and Treatment. And it's basically the discussion that a doctor or other trained healthcare provider will have with a patient, basically asking them what care they would want in an emergency if they were to get really unwell. So for this fictional conversation, I'm going to be the doctor and Amber's going to be the patient. So Amber, are you ready?
Ready.
Brilliant. Okay. Hi, I'm Dr. Fox. You can call me Ben. Can I confirm you are Amber Fox Air?
Hello, Ben. Yes, I'm Amber.
If it's okay, I'd like to spend a few minutes discussing the treatments you would wish to have or not have in an emergency. Now, this may sound silly, but in this hospital, we routinely check with all patients whether or not they would like to be considered for all treatments, and that includes resuscitation.
Whoa, am I that sick?
No, not at all. But we basically go through this process called ReSPECT, so that you and I, and also anyone that you want consulted, can agree upon the treatment that you would wish for in the case of an emergency. So I stress you're not sick enough to require this emergency treatment. It's basically if you were to get that unwell.
Oh, phew, okay. All right. Well, that makes sense. Thank you.
Excellent. I'll be using this form here to document the summary of our discussion. This top purple copy is yours. So when you're discharged, you'll actually take it home. And if you ever end up coming back into hospital, if you just bring it with you, and it'll be able to update the team of what your wishes are in the event of an emergency. So to start with, what do you prefer to be called?
Amber.
That makes sense. Why are you in hospital, Amber?
I've got a chest infection.
And do you have any other medical problems?
Not that I know of.
And do you have any care planning documents such as an advanced care plan?
No.
And do you have anyone that looks after your legal matters?
No.
Okay, as I said before, now some of these questions may sound silly. So the first one, if you can imagine a scale, and on one side we have living as long as possible, and on the other side is quality of life and comfort, where would you find yourself on that scale?
Really right up at living as long as possible.
Next question. In the context of you being unwell with your chest infection in the hospital, what do you actually most value?
I'd say probably being able to see my family.
And what do you most fear?
Dying.
Okay. Now this next section asks for what's called the clinical recommendations for emergency care and treatment. So this is basically me as the clinician writing down the recommendations based upon the discussion that you and I are having. So the options we've got are prioritizing extending your life, prioritizing comfort, or a balance between the two. Now, based upon what you have said already, I think we're heading towards prioritising life. Is that correct?
Yeah, I'd say that's correct, yes.
Now, excellent. So with that in mind, what I'll put here, I'm going to write it here and you can see, I'm going to say you're for full escalation, and that will include admission to our intensive care unit and high dependence unit, and also cardiopulmonary resuscitation CPR. In the event your heart was to stop beating, we would actually perform CPR on you. As I said before, I'm not anticipating this is going to happen, but it's quite nice to document that these are your wishes if it was to happen. Now, are you happy with that and happy with me writing that?
Yes, very.
Excellent. Okay, I'll do that. Okay. So the next part. I'm documenting here that you are of sound mind to have this conversation, and you've been fully involved with this conversation. And then underneath here, I'm actually signing my name, writing who I am, and also who is the lead consultant looking after you.
Okay.
Now, can I take a record of the name and contact number of your next of kin?
Yes, my husband is Joseph Eyre, and his phone number is 613-613.
Now, did you want me to give him a call to basically give him a summary of this conversation? I'll basically update him of your current status with regard to your chest infection, but I'll also say that we've agreed that in the event that you get unwell, you are full escalation. I'll stress that we don't anticipate you're going to get unwell, but this is a routine thing that we do. Are you happy if we do that?
Yeah, please, if that's not a bother.
No, it's not a bother at all, and I've done that now. So just to recap, this document will sit in your notes whilst you're here, and when you're discharged home, you'll receive this top purple copy. And as I said before, if you happen to be readmitted to the hospital, just please bring it with you, and that will actually help the team because we've actually done the legwork now with this conversation, so they'll be up to speed with the picture. Does that all make sense?
Yes, yeah, that sounds
And
great. Thank you.
and do you have any questions at all?
No questions.
Thank you. Brilliant. And I'll document everything in the notes as well.
Oh, thank you, Doctor. Thanks.
Brilliant. Thank you. And NC or Fade to Black. And just to kind of just for anyone that ends up listening to this, this is all fictional. So the people in this example were completely fictional.
I do not have a chest infection. I can confirm.
Excellent. That is good to know. That is really good to know.